Straightsmile Solutions, straightsmilesolutions.com, and today we're ramping up for CDA 2022 in San Francisco, and the topic of the lecture that I'm going to be doing at CDA is about decreasing your refinement rate. So let's talk about what is a refinement rate and why is it important that you know your refinement rate, and how do you find out what your refinement rate is for Invisalign? I'm sure you can find it out from other aligner companies too, but you can definitely get those metrics from your territory manager. They should be able to get those metrics for you to know what, and you can also just manually figure it out. I mean, you just audit your cases and the ones that are finished, and you see which ones had refinements. Now, I like to always throw out the ones where the patient moved or the patient just said they didn't want to finish. I mean, you didn't finish those cases, right? So of the ones that were actually quote unquote finished and idealized, what is your refinement rate? What percentage had to do at least one refinement? Now, what's a normal refinement rate for an orthodontist versus a general dentist? Well, it should be the same, and it really should be 0. So, I mean, certainly no orthodontist is going to have 0. We're going to probably have 10, 20, maybe 30% max. But most general dentists that I've checked out have more like 70, 80, 90, 100%. And that's way, 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 way too high. And a refinement for Invisalign is like a bracket repositioning for braces. You shouldn't have them. If you have them, you did something wrong. And none of us are perfect, right? But just like you can use indirect bonding to have a computer digitally place your brackets to decrease the likelihood of needing bracket repositions, you want to get it right the first time and just sail through, right? You can do the same thing with aligners. You can have, first of all, you can have an orthodontist double check your Clincheck to make sure it's a decent Clincheck. Remember, you never do what the technicians say. The technicians are not orthodontists, and if they say they are, they're lying. They may have one on staff that's trained in another country, trust me. Their goal is to churn out as many possible approved Clinchecks as possible. They're a public business, right? They're a public entity. That's how they get their metrics, is getting as many approved as possible. They're a business, you're a business. Your job is to get the best outcome for your patient. Their job is to make the most money. Sorry, 2 different things, okay? So you need to learn what a good plan is and how to optimize your own plan. That's gonna take time. Unless you are an orthodontist, you're not gonna be able to do that. And all these classes that are put on by Align Technology, no. I've sat in on most of them. I've audited a lot of them. It's terrible information. Why? Because it's all about keeping the treatment plan short, sweet, and messy. Not well done, not optimized, not idealized, not good, healthy movement. It's about keeping things short and sweet so that they can get the most money, not that you're doing the best thing for your patient, which is a liability for you. You need to know how to do the right thing for your patient. There's always options, don't get me wrong. There's sometimes when that patient really wants short, sweet, even if it's not perfect, and that's fine. But you can't offer your patient that version unless you can offer your patient the understanding of what perfect is and show them perfect. And if you can't show them perfect, you have no business doing short and sloppy, because that is where you can get yourself in trouble, either with your insurance company or with your dental board. If the patient was to complain, it's going to get escalated to someone like me, who's going to look at that and say, that's a terrible Clincheck, okay? That wasn't done right. Did they show the patient ideal? If you did not show the patient ideal and you don't have that documented going back into your portal, and you don't have the verbiage documented in your chart, and you don't have a signature from your patient saying that they declined ideal, you can be in trouble, okay? I know I've kind of gone off tangent, but I really need you guys to understand that. So let's go back to refinement rate. First thing you have to do is idealize your treatment plan. Make sure it's a predictable treatment plan that can actually happen. Second thing you need to do is slow down your aligners. I always recommend that you double all your Clinchecks. So once you get it right, if they tell you it's 25, it's now a 50, okay? Bare minimum, maybe even 2.5. On ClearCorrect, I do 3 times, okay? Because theirs is so fast and ridiculous. It's not even healthy for the teeth and gums and bone, in my opinion, okay? As an orthodontist, I know what a movement is healthy, stable, and what's more likely to damage bone, gums, teeth, roots, and cause tipping instead of translation, okay? Every orthodontist I know that does Invisalign, we slow it down. I don't know anyone that does it. We just look at it and we just laugh and we go, that's ridiculous. Who's gonna do that? Double it, okay? The other benefit of making it longer is it actually doesn't make the plan longer, it makes the plan shorter, because things are more likely to track. Patient is happier and more comfortable. Patient isn't in as much pain. It's easier for them to seat them. They're more clean. They don't have to leave them in for 10 days, 2 weeks. They might leave them in for 5 days, 7 days. And I'm not even gonna get into the whole wear thing because I have a zillion videos on that. If you wanna know about Invisalign wear schedule, just go into, you can even just go into my channel and search in the search bar, go to Straightsmile Solutions channel. You have to be in my channel. From there, there's a little magnifying glass. You can put in like 7 days, or you can put in alignment delivery instructions, and all those things will come up because it's not a standard thing. There's actually a procedure to that. It's not as simple as it sounds. Okay, so double it, optimize it, and then lastly, you need to create an accountability loop. What does that mean? Well, I mean, I've done aligners on, I don't know, thousands of people directly and maybe hundreds of thousands of people indirectly, helping other doctors do it. I mean, a ridiculous amount of aligners. And the one thing that I know, the doctors that use an accountability loop, a virtual accountability loop, are much more successful, and they have a much, 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 much lower refinement rate, down to the level of the orthodontists than doctors that don't. There are free ones. If you're using Invisalign, you can use Invisalign Virtual. It's free. It's a little bumpy. It's a little clunky. You're going to have an app on your phone, the doctor's app. The patient's going to have a patient's app on their phone. My suggestion is that you help them download it and learn how to use it because it's not necessarily self-explanatory. You need to give them a set of retractors. You need to simulate it in the office at the delivery appointment, make sure they know how to use it. I mean, in our office, I can tell you what we do, and a lot of it depends on the demographics of your patient. In our office, tends to be a variety of different ages, and we have patients that are in their 20s and 30s and teens. We have patients that are in their 60s, 70s. We like to give our patients an option of coming more. Some patients are really our office is pretty central, so it's pretty convenient for patients to come, and patients like to come. There's a McDonald's there, there's a Chick-fil-A there. I mean, it's not inconvenient at all. So we don't really have a problem getting patients to come back every few aligners to check in person. But if they're busy, or if they're on vacation, or if they're like a really busy person that's kind of groaning at the idea of coming in monthly for an aligner check, then I recommend putting them on a virtual check. Virtual check, you can use Invisalign Virtual, or you can use a handful of different other programs. Some are affordable, some aren't. The one I like is called In-Hand Dental. Very affordable, in the 100s per month for I think up to 30 or 40 patients. So that's only like a couple dollars per patient per month. You're going to have a HIPAA compliant portal with an app, similar, but the nice thing about that is it's not only for your Invisalign patients. You can use it for any aligner company. So if you're not only using Invisalign, you've got braces, you're using SureSmile, you're using Global, you're using ClearCorrect, you can use it on anyone, and it all goes into one dashboard, which is great, right? So that's the one thing I like about that. And it's very, very, very easy to use. So definitely want to do that. You want to make sure that your patients get the thumbs up or thumbs down and they don't progress on to their next aligner unless there's 100% tracking. I like to double check the tracking, slightly open, front, side, to make sure it's all 100% seated. If it's not, I'm going to ask them to try in their previous aligner. If that's still not fitting, try in the previous aligner before that. Make sure they're saving all their old aligners, right? And then the other things you should be checking is the bite. It's even nice if you give them articulating paper, teach them how to use it, of course, tap, tap, tap. And then take your 5 intraoral photos. These are going to be biting down, front, side, top, bottom, as much as you can. I mean, it's not going to be perfect. It's not going to be orthodontic level photos. It's just rough photos so we can see what's going on. Obviously, if there's any red flags, if things aren't fitting, we're going to tell the patient to either go back and try on the other aligners, or we're just going to have them bring all their old aligners in. Remember to make sure they save all their old aligners, and we're going to find out where they are. If it's like way off, we're going to do a refinement. But most of the time, if you do this virtual check-ins, we can block. We won't have to do a refinement because we're going to tell them, hey, look, that's not fitting. We're going to catch the problem before it snowballs and gets really, really bad, Go back to the right aligner. Maybe now they're going to be in 2 upper and 3 lower, instead of 4 upper and lower, and have them catch up because we're not all perfect. And sometimes we have a bad week, right? All right. So just creating some awareness about your refinement rate and how this can make your office way more productive because patients hate refinements. I mean, sometimes they're necessary, but patients really hate them. They lose trust in you. It's expensive for your office because every time the patient is coming in when they don't need to, it's taking up chair time that could be profitable chair time. So if you can create that accountability loop, you will sail through your aligners way faster, get better outcomes. Patients will be happy. They'll leave you good reviews. They'll send you referrals, and Ortho's going to be really fun for you. All right. Thanks so much.